Okay, so hi everyone. We're a few minutes past the hour, so we will now kick off. Welcome to our Halloween special, Continuing to Care webinar. I'm your host, the Wicked Witch, and Adam and Dan will introduce themselves very shortly. Quick bit of housekeeping before we start. So this webinar is being recorded and we will be sharing the recording after. Everyone is on mute apart from Adam and Dan and myself. We have about 45 minutes in the diary, so for the next 30 minutes or so, Dan and Adam will take us through the content of the webinar, and then we've got 5-10 minutes at the end to answer any any questions. On your screen, you have a Q&A tab. So if you have any questions, please submit your questions on there. We will now kick off. So I'll hand over to our panelists, Adam and Dan, aka Dr. Evil and Count Dracula. And they will introduce themselves and then we'll dive in. Over to you. Thank you.
You do look a bit like Dr. Evil.
You do. You're more than Count.
Yeah,
I was trying to work out.
Yeah. After you, Adam.
Okay, so hi everybody, my name is Adam Tallis. I'm the village manager here at Eden Court for Cinnamon Care Collection. We're a care home of 78 beds and we have 28 apartments. So currently we've got a team of about 80 running the site. So quite different from a normal registered manager's role because you've got apartment owners, a bit more community living. So my career began in hospitality. Where I worked my way through hotels. I worked at BMA, Law Society, Royal College of Surgeons. My grandmother was diagnosed with dementia with Lewy bodies, and I went through that task of finding care for her and decided I could do a better job. What a brave person I was. So I joined Bupa in 2018 as out-of-sector manager and became registered manager with them, managed a couple of their homes. And then did a commissioning for Loveday & Co in 2021 for one of their new properties in Kensington, and left there to join Cinnamon in November 2022, so a year ago.
Congratulations on your 1 year anniversary.
I know, thank you.
So Adam's the main panelist today, so I'm just really to help facilitate, but I'm one of the two co-founders of Florence. My background was I was in the military for a few years, sought some service in Iraq. Then I went to work in the City of London working for a couple of banks, doing project management and various jobs before volunteering in the care sector. And during my time as volunteering, I looked at the way staffing and basically most things were managed. It was still very inefficient, lots of paper, spreadsheets, loads of things that could be done better. And sat down with my co-founder in 2016 and thought, can we do staffing a bit better than it's done? And that's where we launched Florence. So the journey has been since that. And I live in London. I have 3 children, 3 boys, 10, 12, 14. So fairly busy, but excited to listen to and learn from Adam, because I think the good thing is he's got a different view of how to do things, which may not be right for everyone, but it's good to challenge the status quo sometimes. And I think at Care we often don't do that enough. So I think let's dive in. So I think the first thing, this webinar is really about continuity of care, and Adam will go into that in a bit more detail, but it's really about how do we ensure there is stable, predictable, it's not just people, but it's continuity across the whole thing to make sure that your organization, your facility, your service, your care home is well run with good information and good predictability. So it's a very broad topic. It's not just necessarily just about people, but Adam's the expert, and I'm going to move on to that. So just the agenda for today then. We're going to talk a little bit about how you manage your rostering and what you do when challenges arise, because everyone in care knows that you do your rota on a Monday and by 5 minutes later it's definitely changed. How you support your residents when things change to make sure that there's consistency and continuity. How you how do you build a reliable bank of people you can go to when you need to, and a little bit a shameless plug to talk about Florence and how we help some of our customers with their residents.
It's taking you this long to get a plug in. That's good.
You know, so a little bit of a shameless plug at the end, but you know, we think we do it better than anyone else. So you know, let's be proud about that. So I guess moving on to the next slide. I think when you have we're going to have a bit of a quick poll right now. And the poll, I think it goes on your screen. It's like, how much time do you spend on these kind of admin tasks? We've done quite a lot of work recently talking about admin and all the stuff you have to do as a care manager. And that's going to run in the background. I think we'll give the results in a second, I think. It says, so here's your quick poll. Any of these things come to mind? If you could click on that, that would be great. It's very sophisticated, this.
I know, I'm very impressed.
They've gone up market. I don't know if you've had enough time there, Julian, or not.
Oh yes, Dan, we've got a few answers. We'll just give it a bit more time, and then we can play back some of the results. Thank you.
Cool.
Okay, so we've got the results of the quick poll. Thank you for your participation. Interestingly enough, and not surprisingly, about 42% of the tasks that take the most is around rota scheduling, followed by 25% of people's time spent speaking to agencies, and then a tied third with 17% of people's time is around documentation, record keeping, rescheduling meetings, reporting, and general admin. So thank you all for your contributions, and I'll hand over back to Dan. Thank you.
Thanks for that. Always good to have some audience participation. So we actually did at Florence, we did a survey a few weeks ago, which has I think been in some press actually. And there were over 250 people responded, and they were, you know, care administrators, managers, people that were involved in actually running care services, and a couple of people from the NHS. And almost 50% told them that like the day-to-day admin prevented them actually doing what they thought was their core job. And in line with the poll we just did, a lot of them said that, you know, just managing rotas took a huge amount of their time. I know, Adam, you've got some good insights into this. What do you think of this?
Yeah, I agree. I think as managers, you never set out imagining that your role is going to be sat at a desk. You want to be out there with your team, with the residents, and it's amazing how much time is taken with these tasks. I mean, I've learned from it. You know, I'm sure we've all gone through that, handing the rota over to somebody else, let them manage it. I don't do that. It's easier to manage the rota yourself, spend that 15, 20 minutes a day on it, and it makes it much more manageable. Because as Dan said before, you can do your rota at 12 o'clock, 5 past, you know, everybody is emailing you, I can't do this, can't do that. And also it's pushing back on the team and saying to them, well, you need to find somebody to cover you. That's the bottom line, you know. I haven't got time to do that as well as everything else. So no, it's really interesting. I thought it was good.
And it's quite, you know, when you were working with other organisations, did you find that, because you're effectively the village manager here, which is, you know, probably it's more senior role than a typical care home manager, you know, how do you think do they typically do the rota themselves, or do they get someone else to do it?
I think normally it's the clinical lead, if I'm right from my previous experience, but you actually want them spending time to make sure that we're clinically sound and safe, and that's really important. So I think, you know, care home's slightly different to a village. I joined the village, I wasn't the registered manager, and I took on the registration. So it's sort of back to being the registered manager again. And it's just managing your time to make sure you dedicate it to your residents.
Nice, okay, so there we go. So I think there's a nice tip there about it might be it might seem counterintuitive to actually get stuck into this thing, but because it's such a big important thing, you know, it probably shouldn't be delegated down to someone more junior. That's interesting findings. Okay, so I think we want to talk a bit about sort of how we look after our residents or patients, depending on your setting you're in. So, you know, I don't know, maybe you can talk about how you manage care plans, how you make sure people follow them, understand them. You know, when you've got people coming in and out of your building, how do you make sure people are, you know, getting the right information? And especially when you get, you know, external people coming in, how do you make sure that
it interacts?
They interact, and ultimately your residents get the best care possible.
I think for me, what's really important is you know, in a care home setting, and it's different in a hospital setting and so forth, is getting as much information before that person moves in. Because if you've got a robust care plan before they move in with everything in place, it makes it so much easier. And I think also, you know, as we said, it's making sure that care plans are understandable. It's no good writing things that nobody can understand, because if you're asking the carer to follow a care plan, it needs to be so they can understand it. It needs to be professionals can use it, and also ensuring that it's regularly updated. You know, I know we're all the same, and I'm sure a lot of you out there use electronic care plans. We use PCS here, and I know there's others out there, and it's making sure that it's used live and the entries are done at the time and not 3 hours later, because you miss bits.
And where does it go wrong?
I think it goes wrong when people aren't properly trained in how to do it. I think that's one of the points. Secondly, when things aren't updated with any changes, and where it really doesn't reflect the needs of that person. Because if you're bringing in an agency person, for example, agency worker coming in to support, if that care plan is not up to date, you're never going to be able to give that real person-centered care to somebody, because you don't understand their needs.
I think from our finding, obviously at Florence, we did a lot of agency shifts, and you know, when there's ever an issue or incidents do happen, a lot of it comes down to, you know, a bad handover or you know, incomplete information. So yeah, thanks for that. QCS, there we go. Plug for
QCS
plug
as well.
For QCS. You know, I'm not a shareholder, but maybe I'd like to be. I think the other thing that we'd like to talk about is you know, what do you do when you do find a gap in your rota, and how do you kind of build a reliable pool of, you know, whether they're your own staff or bank staff or even like favourite you know, agencies? How does that practically work, and what recommendations do you have for people?
I think for me, you can see the things that are written there, but it's also around, you know, communicating and keeping engaged with your own team. Very often we'll have bank staff, you know, pool staff who work for us, but we only speak to them when we want them to cover a shift. So it's making them feel involved, making them feel valued as well, and spending that time to do that and build that team. And the same with when you have to outsource to an agency, is making sure you get consistent continuity of staff. For a resident, you know, to see that same face, even if it is an agency worker, is vitally important. So for me, it's about, you know, really cherishing your own team. If you look after them and make them feel valued, they will pick up shifts. Of course, it happens when you're the manager and you're managing the rota and you ask them to cover a shift. But for me, it really is making them feel valued. That's a big plus. And also continuity.
Yep. And for those ad hoc people that you have in your bank or your pool or whatever you want to call it, I mean, when you say keep them engaged, what does that practically mean?
So I think it's, you know, making sure we do regular newsletters, sending them out to the whole team, telling them what's going on in the home, telling them any changes. You know, we do activity fun days as well with the team, making sure that everybody gets involved. So it really is involving them so they feel part of the home as well.
What's your best fun day you've ever done?
My best fun day. God, what's the last one? Bingo. Bingo night. One of our sales team, was the bingo caller, sparkly jacket. But don't worry, Dan, I've got you down for the next one.
Bingo, well, that's interesting. I think we're going to come to another quick poll, I think, now. So this is more around how do you build this pool of staff or your temporary work. So it'd be great for people listening just to quickly click one of these drop downs. How do you build your pool of permanent temporary staff?
Thank you both. So we'll give a few more minutes for people to cast their votes, and then we'll play back some of the results. I'll give you a few more seconds. Thank you.
Handwritten documents. You're a fan of it.
I'm a fan.
You're a fan of a notebook, aren't you?
I am.
Why don't you explain? You're a digital pioneer, but you also like notebooks.
I think for me, if I take rotoring, so we've got electronic system we use for rotoring, but I still live in an A4 spreadsheet.
Right.
Because you can very easily see what's happening, what's going on, and the team will then update it for you. And secondly, a notebook, because if I don't write things down as I go around, I'll never remember them when I come back to the desk at the end of the day. And it's also those comments that are really important, feedback that you get that you can then use, just having that chat with somebody, you can remember who it is. As I get older, my memory's not as good as it was.
Well, I'm not as old as you, but my memory is terrible. So,
yeah, so you need a notebook.
I definitely need a notebook.
Yeah.
Do you have the, there we go.
Oh, look at this. There you go. Come on down.
So people use a spreadsheet in line with a handwritten document. Adam, you look like you're in the minority.
I know, look.
But maybe you've got the combination of the two, some kind of digital platform or other. I imagine WhatsApp is probably up there with high usage.
Yeah. It's an interesting one, WhatsApp, because you get some team members don't want to be part of a WhatsApp group, don't want anything to do with it, and others who really embrace it. Yeah, so it's good.
How do you manage that when you've got some people that want to be contacted a certain way, some that want to be contacted a different way? Is that
so? The rotoring platform we've got has got messaging on as well,
right?
So you can message them. I think some people are just funny about who's a member of a WhatsApp group. Yeah,
fair enough. And where does your data go?
Yeah,
and
who's using it?
And what do they do with it?
Yeah, exactly.
Good stuff. I think now we're going to. I think we've done the fun. I think we're now going to just show you a very quick 1-minute overview of stuff we use in Florence today that we've built over the years to help people fill shifts with their own staff before coming to an agency. So I'm interested to see this video. So I think what you're seeing here is that you're within the Florence, within the Florence platform. You're adding your own staff to the platform. Very simple. Whether you want their phone number, email, and they come in. And then what happens is that staff member joins your bank. You can assign them to various different units or different floors, different roles. People can do multiple roles if need be. And then what happens is when you have a shift to fill, you go in, you post that shift, and initially that shift gets sent out to, here we go, posting a shift, a day shift, in a few days' time. You're sending it out to your own staff first, a few clicks of the button, and away we go. And that shift instantly, a bit like your messaging system, goes out to your own staff. They get alerted, they can pick up that shift. And if after a certain period of time it doesn't get picked up, then it goes out to the Florence agency workers who can pick it up. So this is quite a quick demo, but it's just showing you sort of some of the simplicity of using Florence. So here we go.
I have to say, I think the platform's great. And one of my things with Dan and the team at Florence was to be able to access it on my mobile.
Yeah.
We're not all sat at a desktop all day long, all night. And when you're sat there waiting, is that shift going to be filled? Is it going to be filled? At least if it's on your phone, you get that notification. It just, gives you that peace of mind.
Well, there we go. We built you a phone app, Adam, that you don't even use. So there we go.
Wow. Wow.
I know, it's only joking. Cool. We'll probably stop this demo, Julian, and move on to the next one. So I guess, I'd love to hear, a bit of your thought process on some of the stuff we talked about. How do you, get continuity across your organization? Key, maybe key top 2 or 3 tips for people.
Yeah, I think for me, it's definitely engaging with your team.
Yep.
That for me is number 1. 2 is keeping control of that rota and that rota management yourself. I know we're all busy, but I think there is a huge benefit from keeping hold of that yourself. I think thirdly, if you're that person ringing and asking somebody to fill a shift, you're more likely to get it filled.
Yeah.
And I think working closely with agents and agencies to make sure that they understand your needs fully.
Yeah.
and that anybody they send meets the needs of the home or the environment you're in, and that you get the continuity and regular people. I love the app where you can choose people who've worked for you before and it goes out to them. So I think those are probably my big things. It's interesting for me because I come from an out of sector career, and I suppose I've brought more of a hospitality approach into care, and we look at it as more of a customer focused journey for our residents, families, and for the team members themselves.
And what do you think the biggest differences are between, what can care learn from hospitality and what can hospitality learn from care?
I think what care can learn from hospitality is that our residents, patients are our clients.
Yeah.
They, without them, none of us will be paid. None of us will have a job. So it really is treating people as a customer. So that's the first thing. I think, what do I think that hospitality can learn from care? I think to be genuine, to show genuine empathy to people, and that you care.
Nice. And I guess one question I always have, because everyone talks about continuity of care, it makes sense, but the very first time you work in a new place, you by definition don't have, you're new. So and it doesn't take long to become part of the furniture, part of the fabric, but what about those first shifts, or those, whether you're your own staff, an agency member, what do you do to make sure those people have the best chance of becoming sort of part of the family?
I think for me, what's really important is to make sure that you've got buddy systems so that people can buddy up, talk to people. I make sure I'm, when I start a new role, is on the floor, visible, seen by the team, because if that happens, the team know you're interested in them. So I think, those two things are really important. But definitely making that, agency worker or casual worker feel part of that team. And that's really important.
So the kind of underlying thread is there is, treat all people that, work with you.
Yep.
In a similar way,
They should be treated like your own work.
Try and make them part of the team.
Yep.
And included, and therefore you've got the best chance of having the right outcomes for your residents, your patients. Okay, I think that's the end of the kind of core content of the webinar. I think we might have a few questions to answer. So I'm just going to hand back to Julia now, Compare, to pose those questions. Hopefully, Adam, you're going to answer them.
You can read them up.
Yeah, Adam can't actually see the screen.
No, I'm as blind as a bat.
He's got the wrong.
Wrong glasses.
He's got the wrong glasses.
I'm like,
Julian, do you have any other questions?
Yes, great. Thank you both very much for this presentation. Hopefully useful and lots of insights and takeaways. And it's very apparent you both have a huge amount of experience in this industry. So hopefully our audience will be able to walk away with some learnings. There's a couple of questions on the chat, and one maybe for you, Adam, which is you touched on it briefly in terms of onboarding new members of staff, but one question was around how do you validate or vet these new members of staff coming to your care homes that are going to be looking after your customers essentially?
Okay, yeah, thank you. Great question there. So any new starter who joins us, our recruitment process is very vigorous. People have to have 3 references. We do enhanced DBS checks. We will really dig into any gaps in employment. That's the first part, as part of the onboarding employment process. And I think then it's ensuring you have enough time for people to do their shadow shifts. We allow 5 shadow shifts. So you can get a real sense of what somebody's like before they actually go and work on the floor. But so it's about making sure that your whole recruitment process is robust through to referencing. I know we're all desperate to get people out there on the floor, but it shouldn't be because people have 2 arms, 2 legs. We all need the right people to work with us to be part of that team to give the very best.
And what qualities do you look for other than just, obviously there's to make sure they've got the right to work,
yeah,
all that good stuff. But what about
personalities? People's personalities. You want to know that, you really, when we interview people, we give scenarios. You want to see how people handle that and listen to their answers. We always ask for examples. So if we're talking to people who are perhaps new to care, give me an example of when you've done something special for somebody. And you can get that real feel, because people, the way that they communicate that and give it, it's amazing, it is. And some of the story as well, I've asked that question, and that alone I would employ somebody based on that.
Yeah. Amazing. I have nothing more to add. Next question, Julian.
Adam, yes, another question, which again is relevant and topical for most of our audience here. And again, you've both touched on it, but if we could just elaborate a bit more. There's a very clear use case where care home managers are dealing with permanent members of staff, their own temporary members of staff, hopefully also Florence members of staff, and last but not least also agencies members of staff. So going back a few slides in our presentation, but we know we've got spreadsheets and we've got other tools to manage all of that, but how do you deal with I suppose the variety of staffing solutions, and how do you consolidate all of that into a platform that enables you to really manage that effectively?
Okay, for us, from our perspective, we use a platform for staffing called Care. Not a plug for Call Care, but
with a K.
Yeah,
with a K.
C. Call Care, which allows you then to put agency workers in, put gaps in, so it'll actually show you when you've got gaps in your rota. So using a platform that will give you a solution, but there are other Southross and there's other platforms out there. So I think if you're using a platform, make sure that it's right and gives you everything you need, that you can add in agency workers as well as your own casual team, and also a good old spreadsheet.
Yeah, good old spreadsheet.
Yeah, that's for me.
I really still struggle to understand why you have a system that you pay for and a spreadsheet as well, but maybe that's something.
Only because reports.
I'll never understand.
Only because reports and rotas that come off of a platform never seem to be in the right format that you want.
Well, there we go. There's for anyone in the rota space, not Florence. There's an opportunity for you.
There certainly is. People want to be able to see it easily, and I'm not convinced that it's often that easy.
Interesting. And hopefully someone will solve that problem soon. Did you say you have one more question, Julian? Just conscious of people's time.
That's it, but actually just a very quick follow-up question for you, Adam, on your last point. So what is the ideal kind of one tool to rule them all that helps you to visualize all of your staffing gaps in one area? If you had a magic wand on Halloween, what would you do?
If I had a magic wand, it would be to be able to access all that information. We put all our different departments onto a platform, onto a rota. It would be to be easily to see it. So I want a dashboard that will show me very clearly, on this day you need this, 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 and this, rather than having to go down looking at the gaps. Yeah. So it would be a platform that is user-friendly for an operator.
So anyone that's in the rotoring space that
give
Adam Tallis a call, there you go. Could be a good opportunity for you.
Excellent. So this brings us to the end of this webinar. Thank you both to Adam and Dan for sharing your knowledge and expertise and answering some of these questions. Thank you to all of our attendees. We will be sharing the recording, and we look forward to welcoming you to our future webinars. And happy Halloween, everyone.
Thank you.
Have a great day, everyone. Thanks.